So good morning, everybody, and welcome to the 8th session of Dairy Tech Online. I'm Matthew Knight, Managing Director of the RABDF, and I've got the great pleasure in welcoming all of you today to this session. We hope you find some really good insight from it and gain some great knowledge in all things hoof trimming and lameness. But before we kick off, just a bit of housekeeping. If you could all keep your cameras and microphones on mute or turned off, that would be fantastic. We have three speakers, or two speakers and a chair today for you. We'll do the Q&A through various points of today's session and then towards the end of it as well. If you do have any questions, just put them into the chat function of this Zoom platform, and your questions will find their way to the speakers. If you're posting on social media, if you could use the hashtag DairyTech21, capital D for dairy, capital T for tech, and 21, all one word, that would be fantastic. And, must say thank you to our sponsors for today's session, Vet Partners. Without their sponsorship, it would be very tricky to put on an event like this. So, thank you very much for that. So without further ado, I will introduce you to today's speakers. We've got Natalie Parker, who's chairing the session. She's got a plethora of knowledge. She's been in the dairy farming industry for a number of years and also very strong in cattle welfare. She's been working with RABDF for a number of years as well on all things hoof trimming, so you're in extremely safe hands. We do have two other speakers today. We've got Will Gatrick from Lambert, Leonard and May Farm Vets, and also James Dixon. So guys, if I could ask you to pop up and take it away.
Hello. Hi, good morning, everybody. Welcome to the talk, and thanks, Matt, for the intro. My name's Will. I'm one of the vets from LLM, and I'll be sort of kicking things off. Then I'll hand over to James from West Point, and then any time you've got any questions, as Matt said, just stick them in the chat, and then Nat, who's our vet tech, you'll be able to put them to us as we go through. So potentially have a bit of a discussion as well as just a sort of lecture. Okay. Just get the slideshow going. There we go. Okay, so the aims of the webinar, aims of the session. So we want to just demonstrate some of the benefits of improving mobility in your herd. That's animal welfare and also financial benefits. So what can be achieved by really getting on top of mobility. We're going to have a look at the anatomy of the foot and how to trim it effectively. I think it's probably worth just saying at this point that hoof trimming is something that takes quite a bit of training and practice. So I wouldn't expect, you've not done it before, you be able to watch this and then go out and start hoof trimming. It's just a bit of an intro, or if you're trimming already, a bit of a discussion or an update on some of the latest sort of ideas with foot trimming. And then James will have a bit of a run through the major causes of lameness and how we can go about preventing them. Yep, so assessing mobility in your herd. I think the first question is what is a lame cow? And that's something that maybe can be something that varies a bit from person to person. People have slightly different ideas. So really the way to sort of standardize that, if we're going to make any progress with lameness, we need to sort of all be on the same page. And the way to do that is mobility scoring. So the registered mobility scorers basically provides a sort of standardized way of doing mobility scoring, so that we can all be calling the same thing, a lame cow or a cow with good mobility, sort of all be on the same page. That's quite important. I'll have a run through mobility scoring in a minute. So also it gives you the benefit of being able to monitor progress over time. So if you're mobility scoring regularly, you can see over time how things are changing, and what maybe benefits that you're getting from things that you're doing and the interventions that you're making. So it's a really useful tool for sort of controlling lameness is sort of the first step, if you like. Also a really good way of identifying cows for treatment. So whether this is sort of routine ROMs, external scorers, picking up cows, these cows that benefit from early treatment. So rather than waiting for them to be really noticeably lame, we can pick them up early and get them in where we've still got a really good chance of getting them right. And that's something that we'll be coming back to quite a bit in this presentation, the importance of picking up cows early for treatment. So what is a lame cow? How do we assess mobility? So the standard scale that most people use in the UK is the AHDB scale. So it runs from 0 to 3, with a 0 being sort of perfect mobility, 1 just not quite walking right, but not particularly obvious which leg it's not right, which leg has a problem. A score 2 is when you can identify the painful foot, the problem, but you can't, the cow can still keep up with the herd. And then a score 3 cow is a cow that struggles to keep up with the herd. So that's a really obviously lame one. So just to give you a bit of an idea of that, we've got a video. This is available on YouTube from HDB. I'll just mute that, and then we'll skip forward a little bit to the start of the just skip through the intro there. It might be a bit jerky, but so this is a score 0 cow. So she walks quite progressively, so she's got no issues there. She's confident when she's walking head up. The score 1 cow, so she's not quite right. It might be a bit jerky to see it, but I say the video's there on YouTube. You want to have a look later on. She's got a slight arch in her back. She's just not quite as confident, but you couldn't say, looking at her, that she's lame on any particular leg, or certainly couldn't easily identify a leg that's lame. So that's a score 1. And then the score 2 cow, so she's lame on her back left. So you can see that it's not, if you look at the biggest clue is these accessory digits on the right foot. They're just dipping lower as she puts extra weight onto that right foot, and they're not really seeing that dipping down in the left foot. So you can pick out that cow's lame on the left foot, but she's not obviously severely lame. And then the score 3 cow, we all sort of know what they are. They're the cows that are really obviously lame. Okay, so we'll carry on. Let me. Okay, so the cost of impaired mobility, how much does lameness actually cost us? So the most obvious cost would be the cost of treatment. So for something like a white line or a sole ulcer, the ideal treatment would be a trim, block, and NSAID, and which is anti-inflammatory. We'll discuss that a bit more later on, why all those 3 things, might be justifiable in maybe more cases than a lot of people are currently doing. So that would be about £40. So you've got about £15–20 for your anti-inflammatory, £10–12 for a trim, whether that's the labour for the farmer to do it, or that's usually roughly what a foot trimmer would charge. And then your block, again, about £10 for a block, and then we'll come on to a bit more detail about that later on. But that's the most obvious cost, but the other costs are more significant and not as obvious. We don't really see them because this is milk we never see, and often it can be a bit deceiving because it tends to be the high producing cows that have more risk of becoming lame. So often the lame cows are still giving quite a lot of milk, so it's more lost potential than that maybe the cows not giving very much milk at all. So typical case of lameness has been estimated as causing a drop of 360 litres of milk over lactation. So if a cow gets lame, she gives 360 litres less milk. So we call that 25p a litre. That's another £90 cost. Then there's the increased calving interval. So on average, a lame cow takes 60 days longer to get in calf. The biggest reason for that is the impact it has on heat detection. So if a cow's lame, she's just not going to show heat. She's not going to be bullying and jumping and doing all those things when she's got a painful foot. So we see average case of lameness costs us 60 days, increase in the calving interval, and every extra day open, we estimate it's costing us £4 a day, so a total cost of £240 there from calving interval and fertility costs. And then the culling as well, so a cow has an increased chance of being culled, particularly with sort of more severe things like, I mean, usually a digital dermatitis wouldn't lead to culling, but certainly a severe lesion, something like a white line or a sole ulcer, those cows tend to lose on average around about a lactation of milk production. So here we've just put the typical cost of a replacement heifer minus the cost of a cull cow, and then we've divided by 3, which is the typical number of lactations for a cow, and that comes to £200. I mean, that's probably an underestimate in many cases. That £900 might be quite optimistic for a lame cow. Often they're not going to be prime, cull cows, and in many cases they might actually be if you like, a dead loss. If they're not fit for transport, then they might not be able to get any sort of value for them. So that £200 is probably optimistic, if anything. And that adds up to a total cost of £570 per case, which gives us a bit of an indication. But the problem with this figure is that it's difficult to translate that into what it's actually costing you per year, because not many people actually know how many lame cows they have. So unless we're keeping really good records of everything that we're treating and seeing, then we're probably not going to know in a year how many cases of lameness we're actually getting. So there's been a sort of a bit of new research on lameness costs. So the AHDB has worked out that a typical lameness case costs about £2.20 for every day that the cow's lame. So every day the cow's either score 2 or 3 on the mobility score, it'll cost you about £2.20. So you can quickly scale that up for your herd. If you do a mobility score, you can see how many score 2 and 3s you have, times that by 220, and that's the amount that lameness is costing you every day. Because it's assuming that if a cow's lame on the day that you're mobility scoring, you have a similar number of lame cows every other day. So you can times that by 365 and quickly see how much lameness is costing you in a year. And the HDB, they do have a calculator, which I'll show you a little bit later on. Goes into a bit more detail. You can put some information in there, and it can quite accurately estimate what lameness is costing you in your herd. So just to sort of demonstrate this, we've got a bit of a case study. So this is Tom and Graham Windsor from the Lodge Farm in Whitchurch, and they are milking 320 Holsteins, producing about 10,000 litres all year round, housed cows. They built a new unit in 2010. They started doing quarterly mobility scoring in 2016, which was a requirement for their milk contract, and they have a foot trimmer in every 3 or 4 weeks. They do quite a bit of self-trimming in between, and they foot bath with formalin 5 times a week. So we're just going to talk a bit about how lameness has changed over time and how that's benefited the Windsors. So this is a graph of the mobility scoring results. So this is being done quarterly. You can see that the green represents score 0 cows, the yellow is score 1, the red is score 2, and the grey at the top is the score 3. And this pattern really, since they started mobility scoring in 2016, they were running at typically about 20% score 2 and 3 cows, which might sound a lot, but it's actually better than average. Most of the research suggests that the average for the national herd is about 30% to score 2 and 3 cows at any one time. So it was better than average, but certainly a lot of room for improvement. And you can see they were running at about 20% up and down up until about the end of 2019, and then you can see this dramatic decrease in lameness that occurred. So there are a few changes that were made that we'll maybe discuss, and I think Tom is available on the webinar. So at the end, if you've got any questions specifically about how they achieve this, then feel free to put them in the chat, and he should be able to answer them for you. She's got a little video. Also, before we do the video, we've got an example of the HDB cost calculator for this farm. So the number of this is available online. You stick the number of cows in the herd, milk production. The milk price isn't accurate. That's just there for demonstration purposes. And then you put in your mobility scores. So normally when you do this, you put in your current mobility scores here, and you put in a target of where you think you can get to, and you can see how much money that would save you. What I've done here is I've put the scores from November 2019 into this area, and in the target I've put their current mobility score. So you can see from the graph they have actually got I think it's less than 1.5% to score 2 and 3 cows at the moment, down from 20%. So massive improvement. So you can see that data in there, and then you plug this in and it works out for you the cost. So this is the cost of lameness per year for the Windsors in 2019 was just under £60,000 a year, which works out £185 per cow, or just under 2 pence per litre. And then this is the saving that they've made. So the amount of money they've saved by reducing their lameness from 2% to from 20% to just under 1.5%. This is saved them over £55,000 a year, or 1.74 pence per litre. So massive saving. And this graph just breaks that down. So you can just see there that the cost benefits come from reduced fertility costs, or improvements in fertility. That's the biggest one. Improvements in yield, and then a reduction in culling. The other costs, like the vet and treatment costs, they're relatively small. So that, worrying too much about spending money on treatment in the scale of a lameness problem is probably not the biggest way to focus. So I'll just play this video.
Cows are trimmed every 4 weeks routinely. We'll do a 60 to 80 day trim, and then we'll do a dry off trim. Any cows that are a bit lame in between, in the meantime, we'll pick them up as well. Or any that need looking at when the trim's here, we'll actually get them looked at while we're cows lifted up to cells. I think we're aiming for perhaps 1 a day, and then through the trimmer we're probably trimming every cow twice a year. So control digi is just routine foot bathing. If we do get a flare up, we will do a digi blitz. Since we've improved mobility, we're noticing you're putting a cow in for sim and it's gone within 2 minutes before he's putting the block on. So yeah, cow health is improved. One of the big improvements in reduced lameness, I'll say staff morale, efficiency of cows, so therefore you're seeing them bulling sooner, getting them in calf sooner. I think the biggest reason we've seen an improvement, stocking density's helped, and picking cows up sooner rather than later. I think we see a lame cow differently now to what we saw them 2-3 years ago. So I think getting the cows up as quick as you can is very important.
Just while you move that on, Will, we have one question coming through asking, are the cows self-scored or are they ROMs assessed? And I think it'd be fair to say at Windsor, the Lodge, they're all ROMs assessed. So it's independent, but they are ROMs approved assessors. Yeah,
so that's done, quarterly, ROMs scoring. There is, so there's no, the Windsors aren't doing a full mobility score themselves in between, but they do spot and pick out the lame cows in between. So that's a big part of it, I think, is they have the quarterly ROM score and any cows get treated based on that. But yeah, then there's ongoing kind of monitoring in between, but not official sort of mobility scoring, if you like, being done. Yeah, and hopefully Tom will be in the discussion, I think, so we might be able to answer some any specific questions at the end about that farm. So we'll just carry on. Let me. Yeah, so the sort of, in order to achieve the sort of improvements in lameness, it does require a team approach between the sort of the foot trimmer, the farmer, and the vet tech team. That's the best way to try and sort of get these benefits. But I think it's worth highlighting that the key person in this is the farmer, and always will be. So it's the farmer that's got to actually implement it. They've got to do the work. They've got to keep on top of it. So getting those lame cows treated early, getting that foot bathing, actually making sure it does get done. I think a lot of people know what needs to be done, but then it's just that when you're busy, it's hard. It is hard to get that done on time. That can be a challenge. So the farm and the foot trimmer, they're kind of working together to actually implement the lameness control plans. Regular trim visits are really important to help keep on top of that. So I think it's worth pointing out, the benefit of a good foot trimmer. So at the moment, there's no licensing required to set up as a foot trimmer, but there is the National Cattle Foot Trimming Association. So they regulate foot trimmers, and that, there are some fantastic, qualified trimmers out there. And what they can do is they can really provide that regular trimming to keep on top of the routine trimming in the lame cows. I think it is challenging for the farmer to do that, and to, on top of everything else that they've got to do when things go wrong and when parlours freeze or things break, and are they able to keep on top of that? I think Tom mentioned in the video he trims about 1 cow a day, so that's keeping on top of those cows. Anything goes lame, it gets trimmed like same day or the next day. Takes a lot of work, but once you get on top of lameness, it's a lot easier. Most of those will be simple things that can be cured and got right really quickly. So treating lame cows early, that's really important. There's no point just having the foot trimmer coming once a month or once every quarter and leaving all the lame cows for the foot trimmer, because by the time he sees them, they'll take ages. I'll need all sorts doing to them. They'll be very inefficient, and the response, the recovery, and James will talk a bit more about that later on, but the response to early treatment is so much better if you can get in there and treat them early before the sort of chronic changes kick in. So the vet and vet tech and the producer, they need to share that mobility scoring data. So the vet techs are doing it, or the vet's getting out there and mobility scoring, make sure that gets back to the farmer quickly so you can act on it, treat those lame cows. And then get those problem cows. So if there's really bad cases that need sort of surgery or amputations, things like that, making sure they get to the vet quickly so that they can, those salvage can be done effectively. And then the vet really needs to be driving the lameness control plans, so providing that sort of guidance on where to focus efforts to get the best benefits. And the foot trimmer and the vet is also really helpful if they can be communicating as well. So that trim data that the foot trimmer is collecting, if that can be fed back to the vet, that's really helpful, so that we know exactly what types of lameness they're seeing, what sort of problems they're getting. And then these chronic cows or C-vet cows, so these are cows that the foot trimmers may be seeing every month again and again. They perhaps need to go and be looked at by the vet to see whether there is anything a bit more in depth that can be done, or whether perhaps an exit plan is needed for these cows. And then again, the mob scoring data, if it's a vet practice that's doing it, getting that back to the foot trimmer so that they can act on that and be part of that sort of advisory team. That's really useful. So we'll just conscious of time, so we'll just have a bit of a run through some of the anatomy. So just showing here the structures, the main structure of the hoof. So you've got the wall, that's a little bit like our fingernail, so that wraps around the front, and there's a sort of unlike our fingernail, there's a 360 sort of wrap around the bottom of the foot there. And then the sole, that's quite a separate structure that comes from a separate place, and that's at the bottom of the foot. So there's the wall and the sole, and then where they meet is a white line. So you can see here's a cross section. So this just demonstrates the bone there sitting within the hoof capsule, and then the corium is this sort of sensitive tissue in between the bone and the hoof, and that's really the key living active tissue of the foot. This is a tissue that produces that horn. So a healthy corium is the key to a healthy hoof. It's where it comes from, and any issues or damage to this tissue will lead to problems in the hoof that we'll see. Just to show a bit more clearly in a diagram. So the wall there, that grows down from the corium up at the coronary band at the top. It goes down the wall. The sole grows down from this corium here in between the bottom of the pedal bone and the sole. And then the white line goes down from this area in between the front of the pedal bone and the wall. And the white line is potentially a bit of a point of weakness between the wall and the sole. Worth just pointing out here that this corium is particularly sensitive in certain areas. So if we go back to this picture, you've got this little piece of bone at the back of the pedal bone here, and this is a bit of a pinch point, which puts pressure onto the corium underneath here. So the whole of this bone, it does move a little bit within the hoof, and that's normal. And the cows are adapted to that. It's actually quite important that when they walk, this movement, it pumps sort of blood and nutrients through the corium and around and helps it stay healthy. But if that amount of movement is excessive, either because there's problems in the hoof, or because the cow is walking or standing, or there's unusual forces being put on the foot, and we'll come to that a bit later on, that puts an abnormal amount of pressure on this sensitive corium, causes inflammation, something we call coriosis. When you have inflammation here, that's painful, and it can cause lameness, and it can lead to all sorts of problems in defective horn production, which leads on to a lot of the lesions that we see that we'll show you a bit later on. Yep, so this is just showing why we trim. So in a normal hoof, you can see that how the bone sits within the hoof there, and when it's overgrown at the toe, that just tips all the weight backwards. So you can see that it puts a lot more weight on this sensitive area here, this pinching site underneath the back of the pedal bone, and you get damage to the corium here, and then you get poor production of the sole. So it takes normally about 2 months as from the sole that's produced here at the corium to grow through and come into wear. So any damage that occurs, you'll see it coming through 2 months later. So if you just get a little short period of damage occurring around about calving, and then that stops and the corium recovers, then you'll see a couple of months later, you'll see that bruising coming through. If that extends for a longer period, then you'll start to get a defect right the way through, and that can lead to something like a sole ulcer. So we'll come on to that a bit later on. So when should we trim? So lame cows as soon as possible. That's really important. As soon as they're spotted lame, really want to be getting them trimmed within 48 hours to get the best chance of recovery. There's been a lot of evidence and a lot of research to show that if you trim cows quickly, so if they go score 2 and we get them treated within a couple of weeks, we've got a really good chance of getting them right. Anything that's been lame for a long time, it gets to be pretty hopeless in terms of actually getting a full recovery. And then routine trimming, that does vary a bit between farms. So the most common one is to do it at dry off. It's a good time because you're then just making sure the hoof balance is right for when the cow calves. So the calving is a big risk point. So when a cow calves, you get all the ligaments slackening off in the hoof. You get a lot more movement of the bone within the hoof, so you get more of that damage to the corium. That happens at calving. So we need to make sure we trim at dry off, or make sure the foot is correct at dry off. It gives you don't want to do it when they're too heavily pregnant. You don't want to do it within, say, a month of calving, so that's a good time. A lot of people add in a second trim at 80 to 100 days of milk. So that's something I think they're doing at Windsor's, and that just means that it's a second chance just to check the foot. Any problems that have occurred in that risk period after calving can be corrected before they have a chance to lead to sort of chronic issues. Then another one is potentially pregnant heifers. Again, if this will vary quite a bit from farm to farm, but if the heifer's feet are getting overgrown when they're pregnant, then trimming them a couple of months before calving for exactly the same reason as your dry off trim, that can be really beneficial to make sure that they've got the best chance. When their heifers particularly are under a lot of stress, often when they enter the herd, they can be pushed out, bullying, spending more time on their feet. So the heifers, we need to really focus on them, look after the heifers, because they're the cows of the future. So we can make sure that they have a minimum amount of lameness when they enter the herd. The biggest risk factor for lameness in an individual cow is being lame before. So we might find if they get lame as a heifer, it might be quite mild, we can treat it, but then the chance of them getting lame the next year is really high. So we need to really try and look after those heifers. And then the Dutch 5 steps, that's probably the most common method that's sort of taught and used in the UK. And then there's also the Dairyland that was put together in the US. They're fundamentally, really, they are pretty much the same. There's only really one big difference, but whichever method you use, you often find that if you watch a experienced foot trimmer, they won't work systematically through the 5 steps, and that's fine as long as you're understanding this and what you're getting to in the end is the correct hoof balance. Then that's what's important, rather than the exact method you follow. And again, another point that's just worth making is not every cow needs trimming at every stage. So it varies from herd to herd. So some generally in high producing intensive herds on concrete, they tend to get high levels of growth, and they do need trimming more. But you need to tailor this to your needs, really, and it's important to think of it more as an inspection than a trim. So every cow at dry off, wants to have his foot checked, lifted up, checked for any lesions, and trimmed if they're too long. There shouldn't be a sort of feeling that you have to trim, and sometimes that's something that you should be expecting your trimmer, you know, every cow they lift or every foot they lift to be trimming them, and not thinking you're getting value if they just have a quick look and then don't trim. Yeah, so the first step, so we always start with the claw that is less overgrown. So that's the inner claw of the hind foot or the outer claw of the front foot. So the purposes of this talk, I'll just keep referring to it as a hind foot, or it can get quite confusing. So step one focuses on the inner claw. So we take the toe length 8 centimeters from the hard horn to the step, and I'll show you that in a minute. Yep, so the first cut of step one is to shorten the toe, and then the second cut involves just taking the sole back to about a 5 millimeter thickness. So you can see that then at the front. So it's a bit more clear on the next picture. It's just coming up there. So in this picture, you can see they've taken cut one here, shorten the toe, and then the cut two is just taken off the sole. So on that less overgrown claw, it's really sometimes less is more. Sometimes you can just leave that one. You don't need to do anything with it if it's not too long. We need to make sure we don't over trim that. Probably the biggest mistake we can make is over trimming. That can lead to thin soles and increased risk of lameness. And we're focusing normally just on the front. So we're trying to maintain this weight bearing area in the heel. We don't want to take too far back on this inner claw. And then this 8 centimeters. So a lot of people probably heard of 7.5 centimeters. That's the sort of traditional recommendation. But that was done quite a long time ago, on probably when cows were quite a bit smaller. So on a modern Holstein, 8 is a better indicator. It's important to measure it from the point where the horn goes hard, is around here, down to this step. So if some people don't leave a step, they just need to leave an extra 0.5 centimeter. And then if you're measuring it from the actual top of the coronary band, you probably need to leave an extra 0.5 centimeter there. So 8 centimeters is a guide. It's important to realize that with experience, you'll realize that not every cow has to be 8 centimeters. So some very large cows with big feet, you might even end up slightly too short there. So you do have to use a bit of judgment. Generally heifers or maybe jerseys, small cows, you might need to go for the 7.5. So there is a bit of judgment required. Just trying to move on to the next slide there. Sorry, it's just skipping. There we go. So so step two. So step two involves basically repeating the same 2 cuts to trim the outer claw. So generally we're taking more of the outer claw because that's usually more overgrown. That's a higher risk for problems, so we want to shift the weight off this outer claw. So we're taking more off here to achieve this sort of balanced sort of 50-50 weight bearing. So this line here should be roughly perpendicular with the sort of the bones of the leg. So we create a nice balanced weight bearing surface. And then the step 3 is modeling or dishing out. So this basically involves taking some horn out of the sole at the back 2/3 of the sole. So this is a more traditional way of doing this with the Dutch 5-step. So you can see that this is the outer claw here. We take a slightly bigger dish, and the idea is we're unloading. So the sole ulcer site, the site where we get sole ulcers, is about here. And we're just taking the weight off that by dishing it out. The Dairyland type trim, they actually do this really quite dramatic dish. So you go quite wide and quite deep, and that has been shown to have a benefit. So what you're doing is you're taking the high risk area out of weight bearing for longer, and the deeper you can do this, obviously without going too deep that you cause an injury, the better, so that it's longer before this area, then this high risk area comes back into wear. Just really, really important to maintain the weight bearing of the heel and around the wall, and then this front third of the sole. And there's a really critical bit here. This is what we call like the inside of the wall, or the axial wall that we call it. This is really critical for weight bearing. So this should never ever be trimmed. And if you see someone trimming this, that's one of the sort of big no-nos of foot trimming, really. Yeah, and then step 4 is basically involves checking for any lesions or problems, and then providing these sort of corrective trimming to deal with that, or further treatment. So I'll hand over to James to run through the next bit of the presentation. I don't know if we've got any questions, other questions now that are relevant at this point, or?
Yeah, it's more, like you're saying, if the foot is the correct length, certainly on the inner claw, the biggest thing is to leave it alone, isn't it?
Yeah.
Yeah. And then the other questions we've actually got for Tom. So I don't know whether we wait till the end to ask Tom Windsor about that, and keep the flow going about what we're talking about in the steps, I think.
Okay.
So, yeah.
Great, thanks, Will. I'm just trying to get back on the slideshow. There we go. Just to before I kick off, I thought I'd just reiterate some of what Will said. But for me, there's two real great joys of lameness control. Lameness is a fairly grim word; it's fairly bleak, and we all start thinking, feeling a bit depressed when we talk about lameness. But for me, there's two great joyous things about getting involved in lameness control. The first one is that early intervention. So Will talked about it. The sooner you get on and trim those lame cows, the more rapidly they will improve. So if you pick one up and give it the appropriate treatment straight away, day one, and then a week later she's walking well, that is a real positive thing to kind of encourage you and keep you going. So always try and focus on those cows first before you start getting bogged down in the real chronic horrible ones, and you'll find lameness control is much more pleasurable and more effective. And the second great thing about lameness control is the better you get, the easier it is. Looking at 50, 100, 200 lame cows walking around is a big and daunting task, but if you can get down to that sort of 1-2% like the Windsors there, suddenly it's easy. You've only got the odd cow to look at, and yeah, it makes the whole job a lot more pleasurable. So think positively about lameness control. If you can get up and running with it and really make an inroad into it, it suddenly becomes quite a pleasurable experience. So yeah, just going to quickly review the lesions that we will mainly see when you pick up these lame cows, and some of the causes and what we can do about them. So the first one is this sole hemorrhage or bruising, depending on what you want to call it. We used to call this laminitis, but it's not really anything to do with the laminae. So sole hemorrhage or bruising is the correct term. Essentially what it is it's pressure going through the horn into that sensitive corium that Will showed you, and leading to bruising and bleeding within that. And that inflammation that then grows on through the horn, and you see it being presented in the hoof at the point of trimming. The picture on the left here is kind of a diffuse all over the hoof problem. That is quite a sort of severe insult that's happened to that cow. Usually you'll see that in heifers that have calved into a herd and perhaps didn't adapt well to cubicles, didn't spend a lot of time lying down, or had a stressful period around calving. Perhaps they had metritis or something like that. So that's quite severe across the whole hoof, and can lead, sometimes a severe version of that can lead to them shedding that whole sole, and you can really struggle to keep those girls walking. The picture on the right is more your classic sole ulcer developing there. So it's very localized at the point of the pedal bone. That it's the point on the bone that Will showed you there, that where the flexor tendons coming down the back of the leg insert onto the bone. So there's a little knobbly bit, and that then is a focal point for the pressure when the cow is walking, and that's essentially the bit we're trying to protect with the modelling that Will was discussing, especially that big dairy lamb model. So you can see it very well in that picture as to where the issue has been localised. If that develops further, it becomes a solar ulcer. You can see that here, again in a similar place. That's essentially just a further development of the sole bruising. So that trauma has been more severe and over a more extended period, and has led to actually a defect in the horn. So the horn that corium has ceased to be able to produce horn, and so there's been a defect which then grows through, and eventually you get exposed corium in the form of that sole ulcer. Most commonly you'll see that on the outer claw of a hind foot, or both hind feet, but we can also see it in front feet, or sometimes in inner claws, depending on what else has happened. So the management sort of factors that we're looking at for both of those, essentially anything that causes an issue with the cow's hoof angle, or results in cows standing and putting more pressure on that sensitive site, will give us a higher risk of sole ulcers. So one of the biggest risk factors is not having a routine foot trimming protocol. So if you're not using a trimmer, or you're not doing the routine trimming yourself, there will be more hoof overgrowth. You won't be modelling out that area regularly, and therefore you've got a greater risk of a sole ulcer. Standing time is also important. So how long cows have to stand. Milking time is a big one, obviously. If parlour progress is slow, they have to stand for greater than 2 hours per milking. That's 4 hours out of their time budget per day. And then anything that gives them less chance to go and lie in a cubicle, be it stocking density, competition for cubicles, or actually the comfort of the cubicle itself. You can see in this particular photo that there's no pressure in terms of cubicle space, but the cows aren't choosing to lie in the cubicles because the design is not optimum, and presumably they're not very comfortable to lie down in. Another really important part of the sort of pathogenesis of sole ulcers and sole bruising is body condition. That's something that's been elucidated in the last sort of few years. We've understood that a lot more. So there's a fat pad in between the bone and the corium, which is made of fat, and performs a really important cushioning function. And cows that are thin, or cows that lose a lot of body weight, will have a much reduced digital cushion, and therefore are much more prone to getting a sole ulcer. So keeping a tab on body condition of your cows is another really important part of lameness control. White line disease is the other main claw horn lesion that you're likely to see. Will sort of showed you where the white line is. So essentially you can see it running right the way around. I don't know if you can see my cursor, but you can see it running from this lesion right the way down around the bottom of this toe. It's just a different, it's a join, it's sort of a cement horn that joins the two separate bits, so the sole growing down and the wall coming down the top. And therefore, because it's a join, it's a point of weakness. Anything that gets in there, be it dirt, stones, whatever, can cause an issue. And oftentimes it starts as sort of a little hemorrhage, so some bruising, again caused by all the factors that we talked about with sole ulcers, can cause some bruising and some hemorrhage there, and that then weakens it further, and then other material gets in. So all of the same risk factors that apply to sole ulcers apply to white lines as well, but also it's the walking surface is very important. So keeping your yards free of stones, and then when the cows are grazing, looking at things like gateways, tracks, etc. The big issue with your white line disease is if that infection tracks up further and gets into higher structures, then that can, you can see this one's got quite a big hole that's going to track further up, and you're going to start getting swelling into the heel, and that can happen with sole ulcers as well. So either of these left untreated will cause much greater damage further up. So that's where it's really important to look at identifying these cows early and getting them treated. So yeah, some of the risk factors, all the same stuff as for sole ulcers, and the body condition factor is true of this as well, but also anything that causes kind of shearing or uneven forces on the bottom of the hoof is also a risk factor. So sharp turns and slipping and cow tracks and gateways or rough concrete are all an issue. And cow handling is really important as well. So an overfill collecting yard with lots of pushing and shoving, or if you're driving cows down the track too fast, anything like that can also have a big impact on because it lessens the cow's ability to choose where it's going to place that hoof. Here's an example of some good cow tracks. Nice and wide, good camber, so it's not going to get puddles, it's not going to get pits and holes. The cows can progress down there at their own speed, and also a good smooth surface, so we're not getting lots of stones and rocks in there as well. So just to move on, those are the lesions you're going to see sort of at the end of your 3 steps that Will's already described. And then step 4 and step 5 are basically designed to help you deal with those and to treat any problems you've seen. So step 4 is essentially about lowering any problem areas. So you want to take, we've already dished out the sort of typical site for ulcers with step 3, but also we're looking to, if we've got a lesion there, we're looking to take that out of wear for a lot longer. It's important to remember that you can't really lower the toe area. That front third that Will talked about is not something we can go lowering, because you will cause more damage and a thin sole. So if there's a lesion right at the toe, this step is less relevant, but most lesions are in the sort of back couple of thirds, be it white lines or your sole ulcers. So we're looking to lower that area as much as possible as per this picture here, basically to take it out of wear for as long as possible and give it a rest to allow it to heal, and to transfer the weight to the good claw. So that's why sparing the heel on the inner claw is really important in step 1, because we want to leave ourselves something to work with if we get to this stage and we're having to lower another claw. So there's an example of where step 4 has been completed. You can see they've not touched the inner claw at all. So we've got plenty of heel to work with there. And then we've lowered the hole back a couple of thirds and dished out that area around the sole also that's developing. That's not to say that having completed that, we don't then need to block it. So some work that was done at Nottingham a few years ago now, looking at what gave us the best chance of a cure rate, and it's something that's been talked about a lot, but it's really important to keep reiterating this. Just trimming the cows is an important part of getting a cure rate, and you can see that they're achieving good cure rates here. So that's 69%. The reason that the cure rates are so good here is because this study was conducted with fortnightly mobility scoring, and the cows were picked up straight away after becoming a score 2 or 3. So these are really early cases. If you went into your average dairy herd now and just picked up and trimmed every lame cow, you would not be expecting to achieve these cure rates, because predominantly a lot of those lesions will have been going on longer. So this emphasizes the importance of that mobility scoring and then the early recognition, because this is how you achieve this kind of cure rate. So the trim only is there. Trim with a block, you get a slight improvement. Trim with 3 days of pain relief is similar to a trim and a block, but the real dramatic improvement was when we combine all of these techniques. So a full 5-step trim, a block, and 3 days of ketoprofen gave a really, really excellent cure rate for these claw horn lesions, i.e. white lines and sole ulcers. So I'd encourage everyone to, and it's in a lot of milk contracts now, that lame cows should be receiving non-steroidals, but I'd encourage everyone to go and speak to their vets about this and get a protocol in place such that you know that when you're treating a lame cow, you're going to incorporate some pain relief into that, and we'll talk a bit more about why that is, why that works in a sec. So this is kind of the theory behind why one of the theories behind why the NSAIDs make such a massive difference, and it's something called bovine bunions, and you can see here there's a reference there for a vet record article from Roger Blowy, and some excellent pictures. So essentially what happens is when you have inflammation at the sole ulcer site or anywhere like that, it's near to the bony tissue, and that inflammation triggers a response within the bone, which causes it to remodel. So if you just imagine if you've broken your leg, the inflammation around the break would trigger your bone to produce more bone to fix the break. That's essentially how that works. And bone doesn't know the difference between that and other forms of inflammation. So when there's an inflammatory process going around near a bone, its response is to grow more bone to try and fix whatever is the issue. So you can see here a normal pedal bone with a nice smooth surface. You can see the knobble at the back, which is where your ulcer site is. But there's no real bumps and knobbles on there. It's all quite nice and smooth. When an inflammatory change happens, you can see as the lameness progresses over time. So just think, these are taken over a period of time, and every day while this process is going on, the cow is obviously walking on there hundreds or thousands of times. She's placing that foot down onto some concrete with all of her weight on top of it. So there's lots of impact and lots of inflammation there. And the response of the bone is to essentially lay down more bone to try and sort of fix this problem. But as you can see, the more bone that's there, or as you can imagine, the more bone that's there impinging on that soft tissue when the cow walks, actually it's not fixing the problem, it's making the problem worse. So where we think the non-steroidals have a massive impact is actually reducing that inflammation and therefore reducing the bony response to it, and hopefully preventing the cow from ending up with these bovine bunions. So this will slow down, if this goes on in a cow's foot, it slows down her chance of curing, reduces the chance of curing altogether, but slows down any recovery. But also once that bony change has happened, it can't be reversed. So that cow has a greater risk of becoming lame next lactation, and the lactation after that, and the lactation after that. So it's really important, A, to catch them quick, because that will reduce the duration of this inflammation, and B, to get your non-steroidals in there as well. So yeah, a really important facet of lameness control. So we'll talk a bit about blocking. As you've seen from that study, blocking is another really important component of this. And essentially just work with the mantra, if in doubt, put a block on it, because you can always take it off. Yeah, I wouldn't. I would put a block on first rather than last, and just assume that most cows are going to need one if they're lame. There's various different sorts here. You can see from rubber blocks to plastic blocks to wooden blocks. I don't know how many people are still using this sort of cow slip style one, so the actual sheath that goes over the front of the cow. They're very excellent in terms of adhesion, so they're really easy to get to stick on well. The problem with that is they then don't come off, and as the cow's hoof grows within them, they rapidly start walking kind of off the back of them. So I'm not a massive fan of those. They can work, but they need a lot. They need to be applied in a careful fashion and to be monitored really carefully. So the good standard wooden blocks still work very well for your kind of early lesions and not too severe lesions. They'll wear off and they'll be gone usually within sort of 4 or 5 weeks. If you have a more chronic or a more a nastier lesion that's going to take longer to heal, these plastic blocks are excellent, like the orange one, because they don't wear. So no matter how sort of inappropriate the cow's gait is, she's not going to suddenly wear it off at a funny angle and start walking wrong on it again. You put the block on and it will stay, and it will stay on for a while, so it gives her a longer to heal. But when you're putting those on, you must have a heat gun to be able to blister the plastic surface, otherwise it won't stick. Just a common garden 20 quid wallpaper stripper does a good job of that, and can help dry the foot out as well. And it's much better than blow torches or setting fire to things and all that sort of stuff. Plenty of different glues on the market. Most of them work pretty well, so I'm not going to go into choice of glue particularly. Positioning your block, again, it's all about trying to give the cow as long as she can off of with a rest to that affected area. So you can see this block here is positioned nice and far back on the hoof. So even though the heel might have eroded a little bit, she's got some heel hole erosion there. You position the block where a healthy heel would be, so it's far enough back such that when the cow puts her foot down, she's not then rocking back off that and stretching her tendons and ligaments. So if you part some of it is trial and error, but if you can set a block like that, then generally she will walk well on it. But if you put the block on and the cow walks off and is rocking off the back, then you just have to get it back in and try again. Definitely don't leave a block on if the cow's not using it properly. And another thing I would always say is if you put a block on a cow and she seems to get worse in the few days afterwards, pick that cow straight back up and take the block off and have a look underneath, because it might be there's something that you didn't spot the first time round, and that's fine. We mustn't have this idea that to treat lameness we treat it once and we put the cow's foot down and then she takes a chance after that. If it's not working, then don't be afraid to pick it back up and have another go, because you might find something you didn't see the first time. So step 5 of the 5-step technique is essentially just removing loose horn. So this is basically anything that's underrun and not appropriately attached to the cow. We're going to remove, just so that there's no chance of infection tracking. So if you've got a white line, taking anything off that you can get your knife underneath, doing it gently. We don't want blood everywhere. If it's not easy to do first time round because they're very inflamed, often if you pick them up very quickly, there's a lot of inflammation. It's not easy to do a good job of this first time round. Again, don't be afraid to pop it down. Well, block it, pop it, and give us some non-steroidals, but then pop it down and pick her up in a day or two's time when some of that's had a chance to settle, and then you can do a better job of getting rid of some of the underrun stuff. So here we've got a quick video. This is of a routine trim, and we can just review some of those steps that Will spoke about earlier. I'll mute that because it's loud. So you can see there's no length needs taking off this. The length is right, which means that the depth is right on the sole on that inner claw. So now we're just looking for the flat surface on the outer claw. So it's been a quick trim off of there to bring a level weight bearing surface across both claws. And then now it's simply a matter of doing the models. So a small model on that inner claw, and then a bigger, deeper model to protect the sole ulcer site on that outer claw. And that's very much it. You know, it's not taken hours and hours and hours. It's not been hacked or chopped at. And you might think, well, did that cow actually need trimming? But just by doing that simple thing as a routine trim, it makes a massive difference to her chances of going on and getting, you know, a sole ulcer. You could just see right at the end, you could see there was a smidgen of bruising just at that sole ulcer site. So by taking all that out, you know, it saves her from getting an ulcer 6-8 weeks down the track. And that is invaluable stuff. So if that's the sort of thing that your foot trimmer is seeing at kind of 60-80 days after calving, and can do that to every cow and prevent them from getting sole ulcers, that is well worth doing. Okay, and just to review some of the other diseases, obviously we've talked about all the claw horn lesions, but there are some kind of infectious causes of lameness caused by usually environmental conditions which allow bacteria to get into the foot. So foul in the foot is a classic bacterial infection of the skin between the claws. It's your cow that was fine yesterday and walks in with a big swollen foot this morning. And the key to these is just prompt treatment. Systemic antibiotics work very well, but you've got to do it quickly. And again, I would always use some NSAIDs to get the inflammation down and reduce the chances of it becoming a more deep-seated infection. And prevention revolves around hygiene, keeping things clean. Another facet is anything which spikes the skin. So we see it quite often if people decide, you know, change the straw, change the bedding, you perhaps in the fresh pen or something like that. If to a more spiky straw, things like pea straw, rape straw, that sort of thing can set off a bout of foul. So just thinking about what you're bedding the cows on is important as well. And then there's the good old devil of digital dermatitis. This is obviously a whole talk in itself, so we haven't got time to go into this in great deal. It's a bacterial infection with a spirochete called treponema, which causes these raw, painful lesions, which can be quite acute, or they can be very chronic and go on for a long time. And it's also the root. It's kind of the complicating factor in a lot of these lesions we can't seem to clear up, because the digital dermatitis gets deep within the, you know, if it gets under the wall horn and grows down, and that's where we get our necrotic toes and stuff like that from. Equally in some bad wall ulcers, if it gets into a white line and gets deeper into the foot, it's very hard to deal with. As I say, that's a whole talk in itself. It responds to antibiotics, and it responds to other agents, you know, non-antibiotic agents, things like copper and obviously formalin in foot baths, that sort of thing will. But it's about getting your treatment to the problem. And you can see here, you can spray it superficially like this second picture, but actually if you open up and look deep in, then there's still more. You've got to get right in there, you've got to clean it out and give it a really good spray. And these, in an ideal world, this needs treating sort of daily for 5 days to a week to give it a proper chance of curing. Foot baths is an important part of control. Foot bathing is not a treatment for DD, it never will be. It is a control mechanism. It is essentially the foot version of your post-milking teat dip. So it's removing infection from a cow's foot before it has a chance to gain entry, and it's basically a disinfection. So, you know, treatment only works by picking the individual cow up and treating her, but this is your sort of control mechanism to try and reduce the number of new infections. The two take-home messages here is your foot bath needs to be seated somewhere where the cows will walk calmly through it and regularly through it. It needs to be easy to fill and easy to empty, and really you must know the volume of it so that you can correctly calculate the amount of solution you put in. It also needs to be long enough that the cows place all, you know, are guaranteed to have a couple of steps with all 4 feet. So we generally work on at least 3 meters long. And you can see the bottom picture here is an automated foot bath. There's a lot of these about now on the grant schemes, things like Hoof count, and they do an excellent job. If they're set up right, they really are a great thing to have. And risk factors for this is anything that involves getting more slurry on a cow's foot, essentially, because that's the mechanism of transmission. A cow with a DD infection will stand in some slurry, and the next cow that stands in said slurry will pick it up. That's basically how it works. So anything that allows increased fecal contamination will increase your risk of transmission. And these are your what we call the non-healing lesions. It's a bit of a misnomer because you can heal them if you catch them early enough. Ideally, we get to the point where we're catching all lame cows early enough that we don't get these. But if we do, then sometimes with the right kind of radical treatment, we can fix these in a period of time. But I would always, I would never trim a cow like in that picture there without anaesthetic. So that's been given a local anaesthetic into the vein and to numb the foot, and then trimmed out and then bandaged up for a few days, because that will be very tender and very sore. And again, obviously given pain relief. This is one that I trimmed, getting on for 3 years ago now, so time flies. So you can see this was a kind of a non-healing sole also that required a bit of extra treatment. So picture 1 there on the left is where it had a real good trim out, and then you can see how within 2.5 weeks she managed to fill in quite a lot of horn. So they can heal some of these lesions, but you've got to treat them in the right way. So just to summarize everything we've said, as shown by the likes of the Windsors there and various other farms around the country, low levels of lameness are achievable and make a massive difference to the bottom line for the farmers who can achieve it. So it's well worth focusing on, well worth working towards, and if you manage to achieve it, can be very, very rewarding as well. It requires collaboration between the farmer, the foot trimmer and the vet, and between everybody we have the tools to deal with this. It just takes a bit of effort and a bit of discussion. Regular mobility scoring is really important because it identifies these lame cows. It's great as a tool for picking them up early, but also as a tool for monitoring your progress and seeing where you're up to. And I cannot emphasize enough this early detection and prompt treatment point. If you pick up a cow very, very quickly after it becomes lame and administer good, effective treatment, if that's the only thing that happens on the farm and nothing else changes, the level of lameness will decrease dramatically. And then we can start looking at risk factors to try and reduce the number of new cases as well. So yeah, hopefully we've given you the idea that, that this is something we can achieve, and it's something that we can that can actually be very rewarding if we work towards it. So I guess we'll take any questions now.
Brilliant, thank you very much, Will and James. Yeah, we've had quite a few questions coming in. Matt, I don't know if you can unmute Tom Windsor, because there's a few questions for Tom from their farm. A couple of good questions from James Yateman. 1.5% is excellent, but realistically, is that a realistic expectation? So if you consider the national average is over sort of about 30%, anything you can do to improve it is going to be really beneficial for your own farm. And you just got something you have to keep working at. And I think Tom and his dad have shown that working with their foot trimmer and really looking at it in a completely different manner, picking the feet up much quicker, they have actually improved dramatically their lameness issue, which was under the national average, and we have to keep saying that to start with. So they weren't, it wasn't horrendous to start with, but within a year they've got it down to 1.5%. So the question to you, Tom, is, do you think that is it's a brilliant achievement? Do you think that you can carry on with that, really?
I think getting it down to 1 to 2% sort of area is it's not a quick fix. It will take you a year, probably 2 years to get there. But I think if you work as a team together with vets, trimmers, staff, everybody like that, it's certainly no reason people can't achieve throughout all sorts of systems, really.
Another question for you, Tom, from Hannah. What prompted you to take action on lameness? Because obviously it's been kind of ruffling around sort of 20–25% for a few years. What made you make that decision to go?
I think frustration of seeing lame cows every day, and then we were noticing the lame cows were, obviously not getting in calf, things like that. Staff morale was a big one. So yeah, no, they're all linked together really. And since we've got on top of lameness, we've probably put 1,000 litres on milk yield. Calving intervals come down from 398 and we're aiming for 374, 375 now. So it does take time, but it's rewarding in the end.
So one thing I remember you mentioning is the fact that for you yourselves, now picking up a lame cow, you're actually quite enjoying it because you see you're picking them up quicker. You feel confident of what your own ability is in fixing them, and then anything you're not quite sure on, you've got the backup of your foot trimmer. Yeah, no, Will mentioned earlier on, foot trimming is a professional, not everybody can do it up to a standard they can. So with our basic training, what we've received from various courses and stuff, we can pick up a foot now and soon get the cows right. 2 years ago, we were picking up the foot and it was almost out of our control because it was too severe of a lesion, really. So yeah, no, once you've got on top of it, trimming becomes enjoyable again, really. So yeah. Brilliant. This is a question for anybody kind of joining on this one. Again, this is from James. A blocked foot on our herd automatically gets a score 2. Is that the case of the Windsors? And I think if I can just add on to that, I think it really depends on how well the block is put on and how soon you've acted on that. If you've got a block onto a foot but you've got some swelling into it, she's still not going to walk brilliantly. If you can get there quicker, I would certainly say that if you were scoring a cow and the block had been put on correctly and in good time, you'd probably still score as a score 1 because you wouldn't track completely right. But I'd be surprised to see her down as a score 2, or certainly not as a score 3. And if it's that case, you probably need to be picking up the foot again and either replacing the block or looking to see if there's another issue there. Would that be a fair comment, James or Will? Yeah,
I think so. I would agree. Yeah, that
I think what they're saying is
they should walk pretty well.
I think what they're saying is that's a decision by the scorer to automatically give them a score 2 regardless of how they walk. That's how I would read that. So that comes down to individual scorers. I'm not aware of that being a requirement under ROMs or anything like that. But essentially, you get down to the low, 1-2% levels. There ain't going to be many cows with blocks on. So the more you tackle this, the less relevant that becomes as a concern. So I wouldn't worry about it. At the end of the day, the block's on there for a reason. It's doing a job. As long as it does said job, then in a month from then the cow isn't going to be a 2. So I wouldn't stress about that particularly. Yeah, exactly. Brilliant. And then we've got another question in. Would a thermal imaging camera pick up early signs of lameness without having to pick up a cow's hoof? Again, I would open that to anybody. I think, yes, it might be a good way of picking up something that could be an issue, but really we want to kind of stress that routine trimming, looking, or just doing these hoof checks is really important, not waiting until we see a problem. Would that be a fair comment? Will, do you want to answer that?
Yeah, no, I think so. There is some evidence looking into these thermal imaging cameras, I think a bit more in beef, things like beef feedlots, where it's a problem to sort of identify lameness, but I don't think anyone has sort of demonstrated a system that's reliably better than mobility scoring. So there's other systems out there, things like force plates and cameras that can pick up lameness. Potentially in the future, they could, if they can get them working well and calibrated right, they might be the future. But at the moment, I'm not aware of an automatic system that is good enough to sort of say like that, this is what we're relying on now, and instead of just observation and mob scoring would be my sort of take on it. But yeah, potentially in the future there might be some. Yeah, I'd echo that. And at the end of the day, we again, we have the tools right now to achieve what Tom's achieved, on many other farms. So I wouldn't stress about looking for gadgets per se, or sort of waiting for that to come along. Let's get out there and tackle it with what we've got now and get on top of it.
Brilliant. Another question from Hannah. Are there any differences in bedding that can affect lameness? Anybody can answer that?
Yeah, so the one that's probably... probably. So go on, Tom. You go.
I was going to say, Will, we're just bedded on sawdust. We are, and we've never found it a problem. Sawdust and mattresses. So yeah, we're on a very powdery sawdust. We did have a flare up a couple of years ago. We went to a more coarser dust and had some particles of MDF wood chip, and we were noticing a bit more trouble with the cow's feet when we were on that, so therefore just standing on particles of wood technically. So yeah, that's our experiences of bedding materials really.
Yeah, as I say, I think the gold standard is deep bedding for lameness. So something like sand or other sort of soft deep bedding, probably sand is a gold standard. But I think it's one factor. So if you've got comfortable cubicles, well managed bedding, good mats, and everything else, then you obviously you can see from the Windsor you can achieve excellent lameness on other systems. But probably the gold standard bedding would be deep bedded sand. That would certainly be the most comfortable. But, yeah.
Brilliant. Another question from Matt. This again to Tom. How much culling was required to get to 1.5%? Did you do much culling, or was it really just working with your trimmer and getting on top of your issues?
That's a good question. That to be fair, we started the protocols probably in about 2016. So you're looking 2017. Sorry, 3 years ago, something like that. Culling rate did rise to about 31%. You've got to accept that if you want to get it back down to where it needs to be. Current culling rate is around 24 to 26%. So once you've got on top of it, it's a lot smoother ride. But you've just got to accept you're not going to get every cow correct to begin with. But once you've just got your protocols in place, it's it's like part of the regime. We'll get told if a cow is not suitable to breed from the trimmer. You just got to all work together really. But yeah, so culling rate did rise to begin with, but it was well worth it in the long run.
Yeah, so this was more for your chronic lameness cows that have had gone too far to that point. Whereas now that you're on top of everything, you feel that your culling rate you can maintain as a low level. You're not having to cull out because of lameness because you're being more proactive. Would that be a fair comment?
Yes, that's a fair comment. Another reason I think our culling rate did probably go slightly higher than we would have liked. Overstocking of the shed. We're running at probably 120% at one stage in one building. We've reduced that to pretty 95, 98% in the same sort of cubicle area, and it's that certainly made a big difference to our feet. But yeah, no, it's a fair comment. Culling rate will just go up to begin with, but once you're on top of it, it's certainly something that's in your control. So yeah.
So I mean, and it would also not be you're not just culling the chronic lame. It's more a case of because they've been lame, you've not been able to get them in heat or see them in heat, and then not get them in calf. So there's quite a few factors that all come back to a lameness issue or can do. So I'm sorry to keep putting you on the spot here, but you're doing a great job. Could you just kind of summary to a few people that have joined us a bit late, what did you do to combat lameness? So you obviously made a decision you're going to get on top of it, and there's a few factors that you've put in place really, isn't there?
Yeah, when we needed to have a big hit on lameness, our protocols then were just trimming off at dry off, and we'll pick them up ourselves. I don't think you can pick enough feet up yourself in a day. So we basically got a system where foot trimmer was coming in every 3 to 4 weeks. We're probably doing 40 to 50 cows to begin with. Now, I've just got it on the computer here. When he first started coming across to us, we were perhaps putting 20 or 30 blocks on at a time in the early stages. And then, now basically cows are going in the crush. We're having all 4 feet checked over, maintained, and they're going straight out. Minimal blocks, minimal bandages, really. So yeah, no, it's been a long process, but it's well worth it. We're starting to use Sexton dairy a lot more now. So to get the carbon interval back to where we've got it down to now, and using Sexton Dairy, it's all a feature, all a factor of getting that success together, really.
Brilliant. So it is there's a lot of elements towards it. It's not one main thing, isn't it? It's working with your foot trimmer, it's working with your mobility scorers, and using all that data that can help you, and obviously working then with your vets as well. So it is a combined target, really, isn't it, or team event?
Yeah, I think that you've got to all work as a team, because if one person is aiming a certain strategy and everyone else isn't on board, it's just not going to work, really. But and it's nice to see now, staff morales are improved, cow flow's a lot better. So yeah, they're just completely different cows to work with as well. So certainly something to achieve if you can. Brilliant,
well done, Tom. Another one from James Yateman. He's just put in, I think we need to standardise scoring. Would you like us vice versa? So I think that's the whole point. We are trying to get to a standardisation of mobility scoring, and that's the whole point of the ROMs and why it was set up. Anybody else like to comment on that, James, at all?
Yeah, exactly right. So the point of the ROMs register is to give us a baseline whereby everyone's looking at the same cow and calling it the same score. You can never completely eliminate between score or variation, but it should be at a low enough level that it doesn't make too much difference. And the most important thing, therefore, is you then have consistent scoring across that herd. So as long as the same person is doing it and they're doing it the same way regularly, you will build a picture of that herd. And it might be that you're 2% one way or another, or maybe even 5% one way or another, versus if somebody else did it. But actually, that doesn't make a huge amount of difference in terms of the kind of interventions that are required on that herd. So the most important thing is that cow lame, yes or no? Shall I go and pick it up? Yes, I shall.
Yeah, brilliant. Thanks, James. And that's the point. There's a lot more pressure from the milk buyers to make sure that we're on top of this. That's why we have a standard ROMs set up for the mobility scorers. And I know that a lot of the supermarket contracts now are now looking that if they see you've made some really good improvements, they come and double check that what has been scored is correct. So there is checks on this. It's not just a case of, oh yeah, well, we're doing that because he's a client or something like that at all.
Yeah, I think Tesco are aiming to randomly check about 20% this year.
Yeah. Okay. Well, unless anybody else that's on can send some questions over, I think we've kind of run out of our questions. But thank you very much, Will and James, and especially you, Tom, for answering these questions. It's been a really insight on how we can really tackle cattle lameness and make massive improvements in a relatively short time with a good team approach. So unless anybody else wants to say anything before we finish?
That's everything. Yep, thanks.
That's great. Thank you. Go and trim some cows.
Yes.
Yeah, just want to say thanks very much for the presentation and the Q&A session and the brilliant hosting from you, Natalie. Thanks, James, Tom, and Will. Really appreciate it. And thanks to Vet Partners for our sponsors. We'll conclude there. Everyone have a good weekend and stay safe. Dairy Tech Online will start again on Monday, where we'll be focusing on the organic sector, and that will kick off at 10:30. But for now, stay safe and goodbye.